The product I came up with was an idea to improve patient care and outcomes and is called SmartPatient. It involves tablets on lanyards as well as tablets in patient rooms connected to software that allows a roundabout communication, healthcare documentation, and optimization and efficiency of skills by nursing staff. With the ongoing shortage of nurses, it's important to remain efficient. SmartPatient features the latest cutting-edge technologies integrated into the healthcare system to provide optimal nursing and healthcare to patients while saving time and money. It includes a system composed of patient tablets, nursing lanyards with miniature tablets attached, and cameras in patient rooms for use under discretion of the patient. These three components allow the patient and nursing staff to communicate back and forth while also checking in visually without having to bother the patient. This technology will change healthcare because it will give the patient more autonomy while allowing nurses to be exactly where they need to be when they need to be there. SmartPatient uses mini tablets around lanyards, and integrates with computer information software to provide optimal care. Real-time video allows nursing staff to view video recordings of their patients at their discretion, which can save time for the nurse not to have to walk into patient rooms to check on their patient. This would not be adequate for all departments, such as in cases where the nurse would need to check dressings or complete a dressing change or a patient assessment, but it can give an idea of how the patient was doing. Another feature is reduction of risk associated with medication mistakes. Human error will always be an element in the human world, but using SmartPatient is a great way to minimize these. This can increase mortality, healing time, and overall patient care. Instant messaging allows optimal communication because it gives the patient the control over their care while also giving them the privacy when family members are visiting or if there's information they do not want to share verbally. Another way the patient can communicate with the nursing staff is through a walkie-talkie feature on the SmartPatient tablet. They simply hold the home key and it allows them to call and talk to their nurse. There is also a standard call button if the patient wants the nurse to come to their room and verbally share their concerns with the physical appearance of the nurse. There are many ways to implement SmartPatient into the healthcare setting. The first step is integration of the softwares. If the corporation does not wish to use their current operating system, there is an operating system available made by SmartPatient which will make the implementation process that much easier. The next step is training. Training staff members and patients is the only way to ensure proper implementation. Tablets are also make training easier with automatic training modules that pop up when staff members or patients are puzzled. The third step is encouraging staff acceptance. The more positivity with SmartPatient integration, the more acceptance will follow. Finally, follow-up is necessary because it can answer questions that may not have been thought of during the training process. Instead of inviting negative feelings, this can change things into a positive experience for everyone. Timeline. Although it will be timely, it will change the way healthcare is administered. Patients will receive optimal care and nurses will be able to use their skills efficiently, leading to overall self-fulfillment, happiness, and satisfaction. The timeline also demonstrates the success and outcomes of the implementation of this technology. The first implementation barrier and/or challenge that may present itself would be the resistance from staff. Typically, employees are resistant to anything they are not already used to Harvard Business Review describes forms of resistance such as persistent reduction in output, increase in number of quits and requests for transfer, chronic quarrels, sullen hostility, wildcat or slowdown strikes, and the expression of pseudological reasons why the change will not work. Overcoming this challenge can be training for support and staff members. Harvard also talks about making the staff members feel the way they were involved in their decision to change ways. This can be the solution to help reduce resistance because it will change the view from challenge to progress. Another barrier to implementation would be cost for training to use the new technology. Although the cost would be initially outlined and expected by the organization, the requirement for staff would be a separate cost. A solution to this barrier would be to try and use support to teach strong members of the staff and encourage them to train others during normal shift hours. This would reduce costs to pay support members for a longer length of time. Since the pilot would take place in a surgical outpatient center, there is more control over how much staff is involved for any given length of time. Another barrier I would anticipate with this new technology is resistance from the patients to use it. Since many of the patients that are hospitalized are of the geriatric group, many may not want to try and learn something new, even though it would improve their care. Many geriatric-aged people still are unable to operate cell phones, which would make them technologically illiterate. Solutions to this would be for nursing staff to use verbiage that help ease their fear of new technology and methods. Positivity can not only reduce stress, but also increase confidence in patients. Evaluation would take place 6 weeks after the final week of training from support. The outcomes to measure would be overall satisfaction with the technology from staff, overall satisfaction from the patients, and overall satisfaction from administration in regards to cost, patient quality, charges, and efficiency. The long-term goal for this technology is to better manage patient care and improve efficiency so that healthcare facilities can reduce costs while overall optimal treatment and care. Organizational goals related to safety and quality of patient care should be evaluated 12 months after the final week of training. The evaluation will involve surveying groups of patients over the course of 6 months to determine their satisfaction while also focusing on the speed of recovery from the start to finish. The questions on the survey for the patient will include 5 questions pertaining to how their treatment and stay was with the healthcare facility. It would also ask if their likelihood of returning for other procedures in the future based on technology and efficiency witnessed by the patient.